Welcome, folks, and trays and suggestions. Today we have an honorable guest, Dr. Richa Saxena, and I'm proud to announce and bring her in front of you because I have got lots and lots of questions till now regarding to the this ovarian cancer and all those things. So we have Dr. Richa Saxena, who is an obstetrician gynecologist, author of several books in obstetrics and gynecology, and founder of the initiative. So she is focusing more on Let's Talk Women's Health and initiative for educating and empowering women through e-learning. So I'm sorry that I have mispronounced this. So I would request, yeah, I hope you all are watching, and for your knowledge, I just want to since I hope the recording was not happening that time. So I'm introducing Dr. Richa Saxena, who is an obstetrician gynecologist, author of several books in obstetrics and gynecology, and founder of the initiative Let's Talk Women Health, and so an initiative to educating and empowering women through e-learning. So it's very interesting. Over to you, Dr. Saxena, Dr. Richa. Just since I'm unable to pronounce obstetrics, yeah. So over to you to just to put some highlight on this. Yeah, and what is your mission and your purpose to start this mission, this particular thing? Yeah.
Okay, thanks, Devusmita, for that introduction. And hi, everyone, whoever is watching. So I'm basically an obstetrician gynecologist, and I moved into academics, and I also write books in obstetrics and gynecology. And besides that, I've recently started this initiative, which is Let's Talk Women's Health. So this is basically for enlightening and empowering women through e-learning and through e-consultation. And specifically, it is important because Devusmita, she invited me for this cancer prevention. So it specifically becomes very important because I think for cancer prevention, cancer education, it becomes really very, very important. Because lifestyle changes, if incorporated in your daily routine, they can go a long way in preventing you from cancer. So that was the reason of joining this show. And because I think that my initiative would be very helpful in this context. So over to you.
Yes. So thank you so much. So some questions, because when we started, because it's a fifth episode, okay, before this, there are lots and lots of questions which come. Okay. First question was that I am an ovarian cancer patient. Okay. And whether I be able to give normal birth to a child.
So it depends on if you are an ovarian cancer patient, what stage you were, and what kind of treatment you underwent. Suppose your uterus was removed, or it was just that the ovary and tube was removed. So based on that, if it is only that your ovary was removed, maybe some of your eggs were cryopreserved. So then you can have a conception through IVF in that case. And in case your eggs were not even cryopreserved, it could be that your cancer was in very early stages and there was no need for removal of your ovary per se. So in that case, you will normally ovulate. It depends on what treatment you underwent. So it's not that it'll not be possible for you to at all give birth. But again, ovarian cancer, it occurs usually in women in their 60s and 70s. So usually it will not affect women of reproductive age group. So such a scenario where an ovarian cancer patient, she wants to give birth would be very rare. So even if it does happen, it can be possible if it is in the early stages through surrogacy and through donors' sperms or through the husband's sperms.
Okay, interesting. Now, since we are focusing on the corporates or the corporate, those who are working, in this case, the how the companies can take initiative is considering that the for the women's health, specifically when you are as a gynecologist, many people visit to you, right? As a every day because the tensions are high, stress levels are high, that the periods they skip, right? Not from the previous stages. In the college days onwards, we found that means now the PCOS has increased in such a rate. People are under stress. So how to control and what exactly the tips you provide to the corporate world to reduce the stress? What they will do so to prevent this type of cancer or any such diseases, autoimmune disease.
So what corporates can do, like what we've been focusing from the beginning, health education, that is something which
Yes.
I advocate and which I foster, that health education is something which is very important. And again, what corporates can do is they can conduct these educational workshops or seminars on a regular basis. And why this is important is, one, I told you that cancer can be prevented through lifestyle changes. So, for example, one very common cancer is colorectal cancer. Colorectal cancer means cancer of the large intestine. So, if you take certain dietary precautions, you can reduce the risk of this cancer greatly. And what are these dietary precautions? That you take in a lot of fruits and vegetables in your diet, which what doctors recommend is 5 portions of fruits and vegetables to be taken in your diet, to have food which is rich in fiber, because if you take less of fiber, then you are more prone to develop this kind of cancer. Again, having a sedentary lifestyle is something which predisposes you to develop several types of cancer. If you do regular exercise, you take lean meat, you don't take red meat, you take more of white meat, you take more of fish, you take more of omega-3 fatty acids, you take in antioxidants. These are some things which will help prevent cancer. So, if health education is provided related to these simple, small changes which you can incorporate in your lifestyle, then this for corporates, this is very simple. They can get hold of a healthcare provider, or they can get hold of a teacher from the community itself who can hold these regular health campaigns or health seminars or health related workshops. Then second important thing which I want to emphasize is that lots of cancers, they can be detected in very early stages. Early stages, I mean, even when the cancer has not occurred. So in the pre-invasive stages where the cancer has not even properly occurred and it is just kind of developing, in that stage, cancer can be detected. And this is specifically true for breast cancer and cervical cancer. Breast cancer again becomes important because it is the most common malignancy encountered in women all over the world. So, for prevention of breast cancer, one, I think all of you know that breast self examination, that while you are in shower, you can just do your breast self examination. And if you detect a lump or something, then you can visit the doctor, because that could be the beginning of, not all lumps again are cancerous, but if there is a lump, it could be an indication of underlying malignancy. And also, because breast cancer is more common in women after their 50s, there's a screening program. Again, this is not in India, but in other countries, they get these regular screening done through mammography. They get an invitation at their home that you need to get the mammography done. So it is done every 3 yearly. In India, we don't have any such regular screening program available, but women themselves, they can be educated and they can be trained and they can be asked to get this mammography done. It's like an x-ray of the breast. It is nothing very complicated. It is just like an x-ray which is targeted towards your breast tissue, and this will help detect malignancy at a very early stage. So even before the malignancy becomes full blown, it'll be detected at an early stage, and at that stage it is almost curable. So corporates can kind of foster these regular healthcare screenings or they can even collaborate with hospitals or some NGOs or maybe some cancer support groups, and they can organize these regular screening programs, maybe 6 monthly or yearly basis, where they can offer these free screening to the women and to all their employees, and they can be kind of assured that if malignancy is there, it would be detected at a very early stage. Similarly, there is a cervical cancer, which affects cervix, which can be called as the neck of the uterus or the neck of the womb. And again, this is one of the most common gynecological cancer which is there in India. In fact, few years ago, this was the most common malignancy amongst women, and there were lots of women dying because of this cancer. Now this has been surpassed by the breast cancer, and but still the number of deaths due to cervical cancer is quite high in India. Again, this can be easily prevented by doing a test which is known as pap smear. And again, corporates can help organize these pap smear screening for women, because this is usually to be done after the woman is around 25 years of age. And this needs to be done every 3 yearly. And if the pap smear, because pap smear is basically they scrape the cells of the cervix and then they examine it under the microscope. So it is a very simple, very painless procedure, which takes maybe few minutes to be done. And the report, if the report is negative, then you can be assured that you are not at risk of cervical cancer. But in case there is a pre-invasive lesion, pre-invasive means that in cancer is not full blown. So if pre-invasive lesion is present, it would be detected through this test. And again, at that point, if it is cured, the cure is almost 100%. It is curable at that stage. So again, corporates could do that. Again, like I mentioned to you, that they can run these cancer awareness campaigns on regular basis, and also they can provide these insurance coverage and benefits to their employees. And these insurance coverage should specifically be targeted not only towards cancer treatment, that is radiotherapy and surgery, but also towards the screening, so that women, they can get themselves screened for these cancers. And they can enter into partnership with various support organizations, various support groups available for cancer. So if the corporates, they get maybe into partnership with these support groups, these support groups will provide a lot of support, emotional, mental, financial support to the employees. If unfortunately, if touch wood, they undergo a cancer treatment, they or their family, then these support organizations, they will be of great help. So you can ask the second question.
Much values, because I am also grasping something where the question comes in my mind is, being into HR profession for a longer period of time, when the leaves come, okay, whereas a female generally takes a lot of leaves, and not only female, male, female both, but female generally due to the time of periods. So specifically on that time, they want to take 2 days leave or 3 days leave. What exactly your perspective towards them? How many days we should give them leave? Is it necessary to give them leaves at that time? As a doctor, please suggest us.
As a doctor, I would say that this is a physiological process. This is not a abnormality, or this is not a problem. In fact, if you are having your regular periods, that means you are healthy. So it's a sign of good health. But yes, it is associated with certain physical problems. Like, for example, women, they have stomach cramps and they have some difficulty in concentrating. So those things are there. So I would suggest that we should adopt a very empathetic attitude towards these women. Empathy is what is more important. Providing them like emotional support is what is important. and maybe giving them a flexible work environment. So maybe if they say that, okay, I can work from home, so give them that. I would not go in for a leave for 2 days or 3 days, but I would be generally sympathetic, supportive to them. And if they feel that, okay, they are unable to continue at office, at least, okay, work from home. It is not a abnormality, it is not a disease. They can easily work from home and they'll be comfortable also. And at the back of the mind, they will know that, yes, somebody does address my problem and somebody is providing me with some kind of support.
Thank you so much, because this is something why we are talking about this. We are launching on 13th. We are here to hear. So any such problems, doctor, you will be finding Dr. Richa in our group. Okay. So you can also reach out to her whenever you want to talk to her, because any certain things, because this we are here to hear is launching on 13th of August, where we are hearing your problems. As in, when you are coming to us, every time all of them are not available, means all the doctors are not available, all the people are not available, but that is a platform where you can share your thoughts, where you can share your problems, and we are there to hear, we are there to support you. So another thing, yeah, some questions which is coming, because this is something which is what exactly as being into this, how, as you have mentioned in the workshops, we have to organize workshops in our organization, right, to educate women, to educate men, women both, right, about how to take care as a caregiver, okay, for a cancer patient. As I know you personally for a long time at this point, so you have mentioned in one of our talk show that your parents, I think somebody from your family is having a cancer, right? Uh, and I think your mother, right?
No, uh, it's my maternal aunt.
Okay.
My
So
my mummy.
okay, so yeah. So just in that case, just share the story and how it is now for this perspective, how it happens. Can you just share a bit story of this, so those who are listening, they can get idea about that, and they can also themselves educate, and they can also come up with their stories. They can also come up with their problems openly with us, discussing with us.
So, okay, so this is a perfect example how health education could have helped. In fact, she suffers from cancer thyroid which is present, the gland which is present in the neck. So she developed a small lump, and any lump which I mentioned previously, which is slowly growing, especially which is growing. If it is not growing, you need not be that worried about it. But if it is growing slowly, and a new lump has appeared anywhere on the body, it could be anywhere, then you should get yourself tested. And this is what she was told also by many of us, that you get yourself tested. Unfortunately, she never listened. In fact, it was not that she did not listen, she was scared of needles. Because she did undergo an ultrasound, and ultrasound also showed the mass there. And she was advised to get a testing done, a biopsy done, which is actually a needle biopsy. So, a small needle is inserted in your thyroid gland and it is sucked out. The tissue is sucked out and it is submitted for histopath. So that was done, and she was advised to do that, but she was scared of needles, and there was nobody to counsel her. At that time, she did not, I was not aware of uh, uh, this problem, because we got to know about this at a very late stage. So she ignored this problem completely. And as a result, the mass kept growing, and it also involved, I mean, the very early stage, what could have been detected at very early stage, it grew into an advanced stage of cancer. And that was the time when she started having great problems, like she started having fluctuations of her blood pressure and all that. So that is the time when she went to the doctor and they did a CT scan and they realized it was a stage 3 cancer which was there. So had it been treated and now she is, God forbid, she is doing fine. The surgery was performed and the thyroid gland was removed. But if this could have been detected at an early stage, then probably she would not have had to face so much. She underwent a lot of problems because one of her lungs collapsed, her voice was lost at one point of time because the cancer became very advanced. But if cancer education would have come at that point of time and she would have kind of listened or she would have discussed it with us, we would have probably suggested her that you go and get at least the needle biopsy or the FNAC done. So, but thankfully, God forbid she's doing well right now. Even though the good thing is the thyroid gland is something which, if removed, person can survive. You need a lot of supplementation in your diet with calcium, iodine, and so on, but at least you can survive. But if somebody has cancer of, say, stomach or intestine, then survival becomes a problem because if that part of body is removed, stomach is removed, your digestion will be badly affected and survival becomes, or the quality of life, even after, if you survive the surgery, it becomes very difficult.
Okay. So thank you so much. Yeah, it's a wonderful thing. And as a caregiver of the cancer patient, how actually the problem is recently we met with an girl, not she is from my family only. She is 14-year-old and suffering from blood cancer. So and she has been given, this is the second time it has been reoccur in her, again reoccur the blood cancer. Okay. So, and what actually is happening in the Tata Memorial, according to them, this is the advanced level chemo is going on. Okay, the injection with this, the children, they do not give it to the children. This chemo therapy, she is taking this. Okay, the third dosage is tomorrow again. So the survival, the thing is for the blood cancer, for any girls, for women, or for anyone, because anything can happen to any men also. So just in that case, okay, as what precautions they have to take, and as a, because it all happens what exactly, and my question is one question which comes, that is, when the parents are too stressed when during the time of birth, is this affecting the child, that is the cancer, because are they during the time of giving the birth, is that also affecting?
Some medications, if taken during pregnancy, they can result in cancer. Or maybe if women, she underwent some kind of radiation, some X-ray was done on her, then it could result in cancer in the baby. But again, what I would advise is the most important thing, sympathy, empathy. More than sympathy, it is empathy which is more important. Because whether you are a caregiver or you are the patient yourself, you're going through a lot of trauma, a lot of pain, and a lot of mental trauma. And you need somebody more than medicines or more than anything. You need somebody who can tell you that no, it's going to be fine, or don't worry, we are there with you. So I think an emotional mental support is what is more important during this time rather than anything else, because in very last stages, fourth stage, or when the tumor or the cancer has spread to the distant organs, sometimes survival may not be possible or it may be very low, the survival rates. So in that case, uh, nothing much can be done in the medical sciences, because chemotherapy also after one extent will stop working. So I think what they should be provided is whatever they want, all their wishes should be listened to, whatever they want to do in life, whatever little time is left. I think we should listen to that. A lot of stress will be there with them also, because kids, they will not understand what's happening. and the parents themselves, they will be probably blaming themselves that probably we did something wrong and because of which the cancer has come. But I think their mental support and their mental well-being is what is most important, and we need to take care of that.
Yeah, thank you so much, because now the days have come where the how artificial intelligence is helping you in this in doing some gynecological, you can say, when we are going for the diagnosis part, how artificial intelligence is taking help. You can get help out of through this process.
So artificial intelligence, as you correctly said, it has changed the medical arena a lot, and that is because lots of diagnosis of lots of radiological findings, it is done via AI. So, like for example, in the AI bot, they will feed in lots of X-ray reports or lots of radiological reports. So then, when you feed and AI reads those reports, and based on that, it'll give you the answer for the test report which you feed in the AI. So as a result, the results are more accurate. Sometimes the human eye may not be able to catch those small calcifications or areas of involvement on the CT scan or on MRI, but that will be caught by the AI. So now these things, now they have made it even more accurate, the reports. So that is there. Plus nowadays lots of, like we're talking about digital health, so there are lots of apps available, wherein lots of devices wherein people can monitor their blood sugar levels, their heart rate, their uh, BP. Lots of things can be monitored. So these things, they have evolved over time and they have improved the healthcare and even the cancer diagnosis and treatment process.
Yes, and now in the rural areas, those women who are unable to get all the benefits. So, what is your suggestions for them? Because still now there is a problem of washroom over there, right? And they are not able to take hygienic the proper hygiene care. So, for them, what is your suggestion as a as and you are already into this gynecological specialized. So uh, what is your thoughts for them? Suggestions for
So again, even if they're in rural areas, we can like take help of the peripheral Anganwadi workers or the primary healthcare workers, and we can educate them to provide them with simple preventive measures like lifestyle changes, adopting, doing exercise, or taking in more fruits, more vegetables, avoiding. In rural areas anyway, they'll not be taking in junk food, but they can be taught about the healthy oils which they need to incorporate, or the healthy meats, or the healthy foodstuffs, or those kind of foodstuffs which provide more antioxidants in the body, so that can be provided to them. And
yeah.
plus, simple things like breast self-examination. That is simple, this thing for which no equipment is required, nothing is required, so they can do it themselves. Because if, and again, I also feel that if women are educated, they will also, besides taking care of their own health, they'll also take care of the health of the entire family, which again becomes more important.
Yes. So there are lots and lots of things to learn from you, because as we are going deeper into this discussion opens a different arena of the life to understand how the situation of the women, what exactly the lifestyle they have to lead. Okay, and another question: as after the cancer, because to avoid this reoccurrence, what are the already the person have a cancer, for example? Okay, and then to avoid this reoccurrence, what are the lifestyle they have to follow? Over
Again,
to Dr.
most important thing which they need to do after treatment of cancer is the follow-up. Because based on what kind of cancer it is, suppose it was breast cancer, or maybe if it was ovarian cancer, then the doctor will tell you that, okay, we need to monitor you by by measuring blood levels of, say, CA-125, which is done in cases of ovarian cancer. Or maybe in cases of some other cancer, prostate cancer, it might be the measurement of uh, uh, prostate specific antigen, which needs to be done, which is again a blood test. Or in case of cervical cancer, it could be that, we need to do regular checkups through ultrasound to see that it is not recurring. In case of breast cancer, it could be that we need to do regular mammography to ensure that there is no calcification or no recurrence which has occurred. So you need to do that kind of regular follow up, which is very important. Emotional health after, because patients tend to land up into depression. So emotional health becomes important. Taking care of your food and dietary habits, that also becomes very important. Uh, High protein diet, high fiber in your diet, low amount of unsaturated fats, low amount of uh, what do you call uh, junk food. That is what becomes important in the follow-up period.
Interesting. Thank you so much for the wonderful insights. Whatever, I would request you to just to summarize. That is what exactly this we need to means not we need to actually as a caregiver or as a patient they have to follow in their routine. Means if we are just summarizing this, that is the food, that is the lifestyle they have to the lifestyle they have to follow.
Food, the exercise, the mental health, which is important, and most importantly, whatever the follow up which the doctor has asked them to do. It could be in form of a blood test, or it could be in form of a radiological investigation. That, okay, you keep getting a mammography done, or an ultrasound done, or an X-ray done. That needs to be done. That needs to be adhered to strictly, because those tests will help in detecting if cancer has recurred, and even before it causes symptoms. And it might be an early stage that, if it is detected early, because you all know that the more you tend to leave the disease, it tends to become more aggressive and it tends to spread further. So if it is detected at an early stage, it could be even the recurrence could be treated on time, and probably you will be 100% cured. So that becomes the most important thing which you need to do.
Yeah. So the my takeaways from you, because I have learned a lot, because as I was listening to you and I have understood from the HR point of view, we should conduct a workshop where we can give training to the employees about how to take care of their health through the process of at least we can incorporate it all the medical equipments, one or two things we can bring it that is for their welfare, because if to reduce their um, attendance, because the reduce the not attendance, they should come to the office their absenteeism, because it is affecting the whole workplace. Sometimes this happens that I am having this problem and I am unable to come to the company. So if we are taking the whole responsibility, taking the giving them the good work culture, it will definitely the workplace becomes more happy and be the profitable. So the perspective which comes in my mind, if somebody is, we should give them the opportunity to, the company should give some benefits to detect from the beginning if anything comes, that is any health issue. Suppose if anybody is complaining about their health, that is they are having chest pain or anything, medical support should be there in the company to give them immediate attention. And the lifestyle whatever they are following, it should be proper, and there should be a chart of individual company employees should be maintained, so that to understand that whether they are in a right track, giving their best to the best performance to the organization. So, Dr. Richa, since we are launching, we are here to hear where you are also, where I would request you to be a part of it, to give them the support, because those people who are having no one to speak, because this happens, right? Stress happens when we are putting all the words within us and unable to speak out, right? I lost my uncle because of this, the stress. And sometimes I also go into stress, and this is going to be a depression. So to avoid this, and stress sometimes causes this cancer, right? If so, to avoid these things, so when the person will be questioning us, and if any questions also comes, because the problem is I cannot see the questions at this point. I would request you to just to come in that, to go to that session as well, to give your valuable answers to them. And Dr. Richa, I would suggest is I will request you to just to send me the links, so that they can also directly connect with you. Okay, any problem, anything, because you are will be the great help for them, to make them as well as answer. Means you can be the best guide to give them the answers. So what is, just share me your link, and the link will be there in the description box. You can directly connect with her, and she is and I will request her to be into, we are here to hear in that uh, WhatsApp group right now, that is going to be a launching, because it is going to, Dr. Swati will take it to the next level, to any app. Okay, initially we are doing from the basic, and then we will be putting this in an app. So would request you to be a part of it and help the people who really need a assistance in this. So thank you, Dr. Risha, for coming, giving your valuable time, and we are looking forward to work with you in this future um, project where we are here to. So it's launched on 13th of August. So yeah, over to you if you want to take some of you.
Sure, you can share the link of my website, www.drrichasaxena.com. That's the website. And through that login, you can get connected to me. So whoever wants any kind of help, I'll be more than happy to give you any kind of help, whatever it is, even if it is just mental support which you are looking for, or you just are looking for a second advice. I'll love to help you out. So thank you for making me part of this initiative. And
Yeah.
that's a wonderful thing what you're doing. We lost your voice.
Okay, sorry. Yeah, because I was into mute. Sorry, thank you. And the thing is here, I love to do this type of work, because I know people sometimes cannot, are stuck in somewhere where they cannot open up. So there are some places where they cannot talk to each other. It's best part, that is the reason we are doing this initiative. When I was talking to Swana, episode 1, Swarnalata, she was talking about there is nobody to hear when her mother was into the cancer, detected with cancer. So that strikes me. And then I thought, why not to do? Because, and then later on, the conversation goes in certain level. Last week only, I took Meenakshi's interview. She was suffered from breast cancer. She was also having certain problems. Okay, so we were just having and all are eminent people in their own field, because Swarna, sorry, she is with the medical part, um, and she is a and Meenakshi is who is a bestseller author, whose books have been internationally now been recognized. Okay, and she is a story writer. She is a unique personality. Okay, so it's people over here are all genuine, with all authenticity, with lot of energy. So this group, we are here to hear, coming with a great hope, with a great to give you all. That is the time to hear from you, your pain, and I'm blessed to have you all, Dr. Cha, Meenakshi, Swanlata, Dr. Swati, and none other than my mentor, my true friend Rahul George, because you all are here with me, giving this support to them to understand their points and giving them the space to talk. So you are now welcome to join. That is, we are launching on 13th of August. 14th of August, we are coming with all the people till now I have interviewed, the names which I have called. They are all, I would request you also, Dr. Richa, to be there on 14th because your contribution will be there. Yes, we are launching, we are here to hear. And in that book, and not only this, in the ebook also, the books will be launched on 13th and 14th. In this book, every details of Dr. Richa's will be there. So I would request you all to please read that book as well. This book is a gold mine. It will help you to overcome any of your problem, any of the things, because they are giving their valuable inputs, they are giving their valuable time, they are giving their valuable learnings. So again, to meet you, this hope we are meeting you on 14th of August with the launch of this post launch of this, because 13th August is his birthday. So if I can get the time, it's fine. Otherwise, 14th August we are coming all together on the same screen, discussing and showing everybody that what we are doing next. Right.
Thank you so much. I'll try to attend. I'm not sure right now for 14, but I'll surely try to make it. Okay, thank
you. Yeah. Okay, my pleasure. Yeah. Bye.
Bye.
Yeah, thank you.